Hello, my name is Dr. Dewan S. Raja. Today I will discuss about port wine stain, that is Nevus flammeus. Port wine stain. What is the definition of port wine stain? A congenital capillary malformation of the skin presenting as a well demarcated reddish to purplish patch that persists for life. So this persists for life. This is different from hemangioma. Hemangioma disappears as the time passes, but port wine stain is the lifelong stain. What is the epidemiology? Present at birth in around 0.3% of newborn, can occur anywhere but most common on the face. What is the pathophysiology? Caused by dilated dermal capillaries and postcapillary venules due to a developmental vascular anomaly. Blood flow is slow, but vessels are permanently ectatic. What is the clinical feature? Color pink in infancy, dark red, purple with age. Surface flat at birth may become thickened, nodular, or pebbled in adulthood. Distribution often along one or more branches of the trigeminal nerve, maybe along the ophthalmic division or along the maxillary division or along the mandibular division, or V2, that is the maxillary, V3 is the mandibular division, V1 is the ophthalmic division. So it may distribute along one or more branches of the fifth cranial nerve or trigeminal nerve. Lesion does not blanch completely with pressure and does not regress spontaneously. Associated syndrome of port wine stain is Stars-Weber syndrome. Port wine stain in V1 distribution. V1 is the ophthalmic division of the trigeminal nerve. Ipsilateral leptomeningeal angioma. These are the brain covering. They have angioma, tumor of the blood vessels there. Seizure, intellectual disability, and glaucoma, that is increased intraocular pressure. So we are looking at the changes in the meninges, angioma, okay, and also there are changes in the brain here, and glaucoma, that is the intraocular pressure increase due to the overproduction or blockage in the passage of the aqueous humor. We have another association, Klippel Trenaunay syndrome, rare port wine stain, limb hypertrophy, and venous malformation. Okay, so this is that Klippel Trenaunay syndrome. Okay, that is here we are seeing at that port wine stain birthmark here. Okay, causes capillary malformation. There will be varicose vein, dilated vein, cause vein malformation, long lived because of increased soft tissue and bone overgrowth this side. Foot swelling cause lymphatic malformation. These are the part may be associated with that of the port 1 stain, that is the Klippel-Trenaunay syndrome. This is rare, but more common, comparatively more common, is the Stars-Weber syndrome. We'll get angioma and changes in the brain. Here is the port 1 stain in the adult stage. The color has been changed. We are seeing some nodules and papules here. Here, this is distributed along the V2, that is the maxillary division of trigeminal nerve. So, what is the diagnosis? How can I diagnose port 1 stain? Clinical examination, imaging, MRI brain with contrast. It is essential to find out any angioma, meningioma, or brain involvement. So we can do the MRI. If neurological signs present or if lesion involve ophthalmic division of trigeminal nerve. Treatment, pulse, dye, laser, gold standard. Best started in infancy for optimal fading, so laser therapy. Camouflage makeup can be used for cosmetic purposes. Okay, so people may not feel good, so they may have option camouflage makeup, so they can go to the social events. Prognosis benign, but progressive darkening and thickening can occur without treatment. Early laser therapy yields the best cosmetic outcome. And that's all about the port 1 stain. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.